Hello everybody, how are you? I'm Dr. Shariful Halim and I'm today going to talk about the students who have just completed their second prof and now they're embarking upon a new journey which is the clinical rotations that they are waiting for long in the third and fourth years. Now they're going to be attending classes, lectures only of clinical subjects. So you have medicine, surgery and gynecology and obstetrics. So among those, what's most important? And as far as I think, the most important thing that students should cover is surgery, because first of all, surgery department is not that organized like that of gynecology or medicine. So the ward rounds or ward classes are not quite of that standard. So students have to study on their own. Gynecology and obstetric department is the most organized department in Dhaka Medical College. So just following what they say is enough for your examinations and also for your clinical life. And medicine department is okay. And about surgery department, the surgery lectures are good, but the wards are not that of that standard. So you have to study surgery, giving it the most priority, and then study medicine, and the least priority should be gynae. Okay, so this is the basic organization. So when you start with fifth year classes, the classes will mainly be lectures, a lot of lectures starting from 7 a.m. up to 2:30 p.m. in many days. So this is a bit boring. Yeah, so among lectures you have, in between lectures you will have your wards at the normal duration, such as starting from 9 a.m. to 11 p.m. So my advice would be to focus on words mainly. So this is your main purpose, to have the fifth year classes, to get a very good clinical idea of what's going on. So suppose someone has a medicine ward in the first part of his fifth year, so he should be concentrating on words. He should focus his study along what's been told in the ward, what the cases he has seen in the wards. So he should study taking these priorities. Okay, so if he gets time after studying for words, then he or she should concentrate on the medicine lectures then. Supposing that he's having a word in medicine, so first word and then lectures, and then if he or she has any time, then he or she should concentrate on studying the other lectures. Okay, so this is the basic organization. So let's talk about books. What are the books that you need to buy? So first of all, medicine. So for medicine, I think the best books for preparing for final professional exam and being very clinically very standardized books are Abdullah Sir's book, Abdullah Sir's short case, long case, and also the radiology book. The ECG book is also good. So buy all books written by Abdullah Sirs. Those are great resources. Don't waste your time studying other books other than Abdullah Sir's book. Study the books for multiple times. Identify what's very important, because there are some things in Abdullah Sir's book that are not that important for undergraduates, that are intended for postgraduates. So first you have to identify that what to study from Abdullah Sir's book and what not. So I will discuss about that in the next video. Okay, so stay tuned for that. Okay, so first Abdullah Sir's book, and after Abdullah Sir's book about Davidson is a very good book, but focus on the things that come in your long cases, short cases and written. So study those things from Davidson's. So don't try, as far as I think, that studying Davidson from A to Z, so many of my friends had this target that they want to cover everything in Davidson A to Z, and what they did, they studied Davidson for maybe one time maximum, and they studied important things also for one time. So I think that the best approach is not that. Best approach should be study the important things from Davidson for multiple times, and that would bring a very good knowledge which is useful in examinations and which is useful in your clinical life. So study what is important and study them for multiple times, repeat them, share them with your friends, and see the patients according to them. Okay, so those are the best resources. And of course, for pediatrics by Abid Sir's book, maybe already most of you have the Abid Sir's book, so it's a great resource. Okay, so about surgery, I think the best book that I've read in surgery is SRB, so Sriram Bhatt's Manual of Surgery. It's a great book. Bailey Lab is good, but it's not enough. It doesn't have enough information. So for exam purpose, SRB is the best resource, I think. And also for clinical purposes, the best book as far as my concern is The Secrets. This book is written by Dr. Nur Hussain Bhuiya Shaheen, assistant professor of Chittagong Medical College. So I think he understands what the students, what an undergraduate student needs to learn in the perspective of Bangladesh curriculum of the Bangladesh medical system, and that's why I think his book is a great resource. Maybe there is some typing errors in his book, so be aware of that. But otherwise, this is a great resource. And some people say Makhonlal is a great resource. I also admit that Makhonlal is a great resource, but Makhonlal has a lot of things that are not actually needed for undergraduates. But if you want to read Makhonlal, it's okay. Okay. So, and the other books about gynae, the books that someone should read is Doctor's books, so Doctor's Obstetrics and Gynecology. I had one fun thing in 5th year. So when I got my 5th year classes, I actually didn't know what is obstetrics and gynecology. I confused between them. So for your information, that someone of you may not know what is obstetrics and gynecology. And obstetrics is actually dealing with the patients who were pregnant and who are delivering and the post-delivery period. So those are the things that are covered in obstetrics. And gynecology is other diseases which doesn't include pregnancy. So pregnancy related things are covered in obstetrics. Okay, so that's the basic idea. So, and also one thing that I want to mention, that many of the subjects that you will study in 5th year will also require some basic knowledge, such as in surgery. When you study surgery, you will have to recapitulate some information that you have studied in 1st year and 2nd year, especially the GI anatomy and other anatomies like prostate anatomy, renal anatomy, or something like that. So to have a good grip of GI anatomy and other anatomy, I think that the best book that I have read is the Kaplan book. It's a book for USMLE, but still it includes the more important things than other books. So I think searching a book with a huge load of information is not a good way. So the Kaplan book will be a great resource. You can buy it from Nilkhet, from KA Medical or PG Medical book. Such price is about 200 to 250 maximum. So it's a good resource to study anatomy from. And in medicine, you have to go back to physiology to have some good grip, especially cardiac physiology or respiratory physiology or GI physiology. So to have a good grip of them, the best book that I think is BRS Physiology. It also costs about 150 or 200 taka, and I can buy them from KA Medical Book House or PG Medical Book House. So those are the most important things about the books and about the lectures. And about words, you shouldn't go to words without preparation. You should always go words keeping in mind something. So study a word case, study a case every day before going to words, and search for it and see that patient that you have studied, because seeing more patients is not that of importance rather than seeing patients with preparation. So that's very important. So sometimes maybe you will not be able to take the preparation of seeing a patient. So whenever you see patient without preparation, please come after coming back to your room, study that case from, suppose, Abdullah Sir's long book, or in case of surgery from SRB or something like that. So please don't see patients without knowledge, because it will not improve you that much. Okay, so always keep that in mind. And about clinical examinations, clinical examination needs practice for multiple times, and it's not about studying from books like MacLeod's. It's more about practicing and seeing videos. So I will make some videos about clinical examinations, and you if you have any problems, you can also search YouTube, and you can see the videos uploaded by MacLeod. And also I have found a great site for clinical examinations, which is actually Stanford 25. It's an endeavor by Avram Varghese, a Stanford professor, but it has very nice illustrations of clinical examinations that are that are needed in day-to-day practice of a general practitioner. So that's very important, I think. And always, if you can make a pro forma of long case, and this pro forma you can make from Abdullah Sir's long case book. Suppose you have take 2 or 3 pages, write down some points like the patient particulars, chief complaints, history of present illness, and keep a space for that. History of past illness, keep a space for that. Other points of history, general examination, keep some points. Systemic examination, for every system make some sheets. Systemic examination parts like examination of the chest, inspection, palpation, percussion. What are the points you need to see? Write them down. And by making this kind of pro forma, you go to a word and take a history of the patient and write down in that pro forma. So fill up the form. Actually, the pro forma is a form. So make a form for history and examination. This will help you to actually grab the most out of your clinical experience, and it will also help you in examination, the final professional examination. So I think it's a very good idea. I will try to make a pro forma of systemic of histories, as some of the students already requested me to do so. So I will make one, and you will get them in my page, Facebook page, and also my groups. So it will be helpful for you, I think. And another thing is that always share your knowledge with your friends, and that's a very good way, because final professional exam has a lot of clinical exams and also a lot of viva things. So you have to share your knowledge, you have to express the knowledge with other friends to do good in viva. And also, if you can, make some notes. So you can make notes from lectures, or the best way that I think is you can make notes by reviewing the board questions that already came. So you can buy a question bank for final professional exam and look for the board questions. What are the important questions that came in Dhaka board or other boards? I think that's a very good idea. So if you make notes, you will get good marks in written. And for OSPI portions, you can buy guide for OSPI, but it's not essential at this stage. I think for preparation of OSPI, you should focus on that in the block period. So that's all from me today, and thank you for watching my video. Don't forget to like it and subscribe to my channel. And if you have any queries, please don't feel shy to ask me. I'll try to address the problems if you have any. Thank you.